So next up, we have ascarids, often referred to as roundworms. And so where our small strongylls were the biggest concern for our mature horses, the ascarids are going to be our biggest concern for our young horses. And we consider young horses up to about 2 years old. And so the thought is maybe older horses develop immunity, but there hasn't really been much to fully prove that. And so our ascarids are going to be in a life cycle of about 10 to 12 weeks. Once again, they're consumed by the horse, often when they're grazing. They migrate through the intestine and they burrow into the intestinal wall. And so looking at our life cycle, so I have a picture of a foal here because that's who's going to be impacted. We have this egg. It is consumed by the horse. And then when it gets to the GI tract, so in this orange, we have our small intestine, it goes through something called hepatopulmonary migration. So if we're breaking down that term, hepato, think hepatic, liver, and then pulmonary, lungs. So this parasite goes from the intestines, it burrows through into the liver, then goes and burrows into the lungs, and from the lungs, it is coughed up. So now it comes into the mouth. The horse swallows it again, and then it can complete its life cycle. And so then it completes its life cycle, it's excreted in the feces, and it goes on repeat, right? And so when it's mature, we can see 200,000 eggs per day. So if this isn't managed, it can get out of hand really, really quickly. And these eggs become infective after about 1 to 2 weeks. And so in these foals or younger horses, if you see a lot of coughing, that can be a sign that the horse has ascarids. And you can also identify, so all three of the parasites we've talked about so far, large strongylls, small strongylls, and ascarids, you can identify on a fecal egg count. You can tell large and small strongylls apart without going through this larval development, but you can see the eggs on a fecal egg count, and you can tell the difference between those eggs and ascarids eggs. So for our young horses especially, it's important to do a fecal egg count to determine which parasite you're trying to treat, because different dewormers are going to be effective for each. So once again, if we are looking at our clinical signs, this is going to be our poor coat quality. We might see a pot belly, diarrhea, pneumonia, liver damage, slow growth. Right? There's an abundance of things. And I mentioned before that our mature horses, we typically can't tell if they have a huge parasite burden or not. Foals, we can tell. And so often here, I'm going to be treating with my benzimidazoles and just kind of wanting to make sure I'm managing them effectively. Also, because foals are just going to be more susceptible to parasites in general, they're going to have a much different deworming recommendation than our mature horses. And so our mature horses were very big on being very selective, reducing those deworming treatments to try to reduce resistance. But with our young horses, because their health is at risk, we do follow more of a rotational deworming for them. And so that's a little bit about our ascarids, our roundworms. Oftentimes, you're deworming the horse, and you can end up seeing these long parasites present in their feces. Or sometimes we'll even see living ones that are coming out. But that's definitely something to make sure you are very meticulously managing a full deworming schedule to prevent the burden that can be caused by this.